Hello and welcome to Pregnancy Info. Today we will discuss the conditions that can be fatal or life-threatening in pregnancy. There are several conditions that can lead to a life-threatening emergency for women during or shortly after childbirth. Some of these conditions can be diagnosed during pregnancy, for example, pre-eclampsia or some problems with the placenta. But some conditions may only develop as an emergency. These different conditions mean that women's experiences of their emergencies will be very varied. What they have in common is a life-threatening and traumatic births they had not expected. Number 1. Hemorrhage. A hemorrhage is heavy, uncontrolled bleeding during or after the delivery of a baby. A life-threatening hemorrhage after childbirth is when a woman loses more than 500 ml of blood. This might be in the first 24 hours or up to 6 weeks after the birth. Hemorrhage can have several causes including an atonic uterus, trauma, retained placenta, other problems with the placenta, some of the other conditions when the bleeding cannot be stopped. Problems with the placenta. Disorder of the placenta include placenta previa, placenta accreta, and placenta prostrata. Placenta previa, also known as low-lying placenta, can have different degrees of severity. If the placenta is near or lying across the cervix, it can block the baby's way out. If the placenta is low in the womb, there is a high chance of bleeding during pregnancy or during childbirth. Placenta accreta is when the placenta is embedded too deep into the wall of the womb. Placenta praecreta is when the placenta grows through the womb wall and into the bladder. Blood pressure and related problems. Women who develop preeclampsia have high blood pressure, fluid retention, and protein in the urine. If preeclampsia is not treated, it can lead to serious complications, while mild preeclampsia can be monitored with blood pressure and urine tests at regular antenatal appointments or by the GP. More serious cases need to be monitored in hospital. Treatment focused on lowering blood pressure, but the only way to cure preeclampsia if it is severe to be delivery the baby, which can be dangerous for the baby if it is premature. Blood clots. Blood clots in the leg or lungs are a leading cause of illness associated with pregnancy and birth and can be life-threatening. Blood clots form in one of the blood vessels, usually the leg, and can break away, causing a blockage everywhere else. For example, in the lungs, a blood clot in the main artery of the lung. Sepsis. Sepsis is an infection that can develop before or after the baby has been delivered. Infections can be more severe in pregnancy, and after delivery, women may be at a particular risk of infection of the womb or birth canal. It used to be known as puerperal sepsis or childbed fever and was a leading cause of maternal death. Septicemia is where the infection spreads into the bloodstream. These infections can develop very quickly or take several days or weeks to build up. Women need to be treated with antibiotics and in some cases may need to be admitted to an intensive care unit. Amniotic fluid embolism. Amniotic fluid is the liquid in which the baby floats in the womb. Amniotic fluid embolism is a very rare complication of pregnancy in which amniotic fluid, fetal skin, or other cells enter the women's bloodstream and trigger an allergic reaction. Women with this condition may collapse suddenly during the birth of their baby, and it often results in the death of the mother. While 1 in 100 births may be a near miss, some of these conditions are very rare, so doctors and midwives may not see them frequently. Often women will need to be admitted into an intensive care unit or high dependency unit for a few hours or days. Sometimes the baby will also need care in a neonatal intensive care unit. In many cases, mother and newborn baby are not able to be together straight away. So this is all about the life-threatening conditions that can be happened in pregnancy, so you should be aware of these problems and conditions to plan your pregnancy. Hope you have liked this video. Share it and also subscribe my channel. Thank you.